Welcome back to another video with Mafato here. In this video, I want to talk about how artificial intelligence is going to affect your job. To simplify what artificial intelligence is, it's simply technology that enables the everyday tasks to be much more efficient. For example, building a website. What used to take a month to build a website for my business now takes me 5 minutes. So this technology that has come out allows for me to be able to do so much more with so much less. So I have good news and bad news. So let me start with the bad news. The bad news is that your job will indeed be affected. But the good news is that you'll still be okay, especially if you're in the healthcare business. It's just that you now have to lean more into technology than you might have wanted to. And I know some of the older workers in the healthcare industry, they don't quite want to embrace technology. But let me tell you this. When a lot of computerization came into your hospital, if you're a nurse, you didn't want to learn these new softwares or these new technologies, but you were forced to, because every time you went to apply for a job, they would ask you if you knew a specific technology. And if you didn't know that specific technology, you'll be left behind. You wouldn't get that job. So that's what's happening with this new artificial intelligence revolution. There will be technology that you'll be forced to learn on the job in order for your job to be much more efficient. Because what's happening now is that a lot of hospitals, a lot of patient facilities, they're now having to be more efficient in their operations. For example, simple admin tasks, things like scheduling appointments of patients, managing patient records, those simple tasks can now be compressed and done in a matter of minutes versus a matter of hours or days. Hospitals are having to get rid of a lot of these staff members that were doing some of these menial tasks that can be replaced with technology like artificial intelligence. I don't know if you've seen this on YouTube. There's a hotel somewhere, I think it's somewhere in Dubai, that would deliver room service using a robot. And you will start to see hospitals doing the same thing, adopting the same technology. Instead of you as the nurse, you having to walk to different rooms, you would use an app, deploy your robots to go deliver the medications to all your patients. Now you're only having one nurse doing everything on an app, and all the labor is done by a robot. There's no longer a need for the hospital to hire an excessive amount of nurses. Maybe they will just hire 2 nurses versus 10 nurses in the same facility. Because those 2 nurses, as long as they know how to leverage that technology, they're quick to learn the technology, and they adopt that technology, they can do the labor that was done by 10 nurses. Now, does this mean that it'll replace nurses altogether? Absolutely not. Being a caregiver is recession-proof, which is the good news. The good news is what you now have to focus on in this new economy, this artificial intelligence economy, is 3 things. You need to focus on empathy, you need to focus on communication, and critical thinking. Some nurses, some caregivers, whether it's a registered nurse, an LPN, they might be slow to adopt technology. So those are the ones that will be left behind. But as long as they focus on those 3 things that I talked about, which is empathy, communication, and critical thinking, they should be just fine. They'll be just fine because there will always be work for those types of people. Now, would that work be available for the high-paying gigs? 9 times out of 10, no. Most likely not. If you are not adapting to this new technology that's coming up, you might not get the best paying gigs in a care facility or a hospital. So it's critical that you understand that artificial intelligence will affect how you do your job on a day-to-day basis. Artificial intelligence will affect things like monitoring diagnostics, patient data, vital signs, lab results. What used to take a couple of days to get lab results to track vital signs of a patient will probably take you minutes now because of artificial intelligence. As all these technologies are integrated, different facilities will start to share data. So hospital out of Cincinnati, Ohio will share data with the hospital in Miami, Florida on issues that are similar and how to deal with those similar issues, and feed that data to a caregiver, like a nurse. And you get fed that data on your app, on your tablet, and that makes you a better caregiver. Let's say your patient has a condition you haven't seen before, but that condition or has been seen by another caregiver in Florida and you're in Ohio. You can go into a database and see, oh, okay, this is how I can deal with this issue. And then you have your doctor consult you on that decision that you're about to make. Artificial intelligence and technology, there's certain things that it cannot replace, but the human touch, you cannot replace that. What you do is you embrace technology and then you focus on managing the less tech savvy caregivers. There's also technology that's coming out that enables you as a business owner now, should you choose to get into the home care business, you can deploy caregivers in different parts of the country. So let's say you're in Florida and you want to open up an agency in New York City. You can still do that in the comfort of your own home in Florida using technology, artificial intelligence. How does that work? Simple. You hire the caregivers online, you deploy the caregivers to the patient's home, and you track their movements online. You can track the vital signs of their patient. And I've seen agencies that have these Fitbit types of bracelets where you can give those little bracelets and Fitbits to your patients and say, hey, listen, this is part of our service. Please wear this so we can track your vital signs remotely. So those are some of the ways that you can manipulate artificial intelligence and all this awesome technology that's coming out to your benefit as a business owner. And that allows for you to be able to scale up your business. If you can do that with one patient, you can do that with 20 patients in the comfort of your own home. Artificial intelligence is actually going to make you way more money if you know how to manipulate it. But if you don't, you would just remain a worker doing all the menial tasks that nobody else wants to do. And a lot of agencies, legacy agencies right now in the home care business are not leveraging artificial intelligence at all. I did a video about how to build a website in under 5 minutes. I've discovered a lot of agency owners don't even know about that. So you can build a website that is much better than your competitors out there using artificial intelligence in under 5 minutes. That's something that was inconceivable years ago. You would have to pay thousands of dollars to do stuff like that. Anyway, I hope you got some value from this video. If you're interested in growing your agency, I encourage you to explore Google advertising to get these clients, because these clients are searching for the services that you have to offer using Google advertising. Your agency should show up in the search results as they're searching for the services that you have to offer. I've put a link to the course you can preview in the description of this video. And I've also added a link for you to schedule a call on my calendar and ask me any questions you might have on how to get clients specifically. I'll end it here and I'll see you in the next video.